Hi, I'm here today with Dr. Kathryn Rouine-Rapp and Dr. Claudia Benkwitz. They are two of our PD cardiac anesthesia attendings, and they're here to talk to us a little bit about the fellow experience on the cardiac rotation. So first, tell me a little bit about the rotation.
So we have a rotation where the Gen Peds fellow is going to be there for a total of 2 months. That means like 1 month each, and the fellow will rotate through the ORs, the cath lab, as well as the Gen OR for non-cardiac and CORA cases. So the good thing is that will provide a very extensive hands-on experience, and because we don't really need our fellows in our staffing model, they can basically pick and choose. Another thing also is that they will get half a day off for the week or 2 days in the month for non-clinical research reading activities.
And the NCORA, just let me just add what that is. That might be a term you're not familiar with. It's just the non-cardiac cases that the children who have cardiac lesions or the children with pulmonary hypertension undergo, and the cardiac anesthesia team takes care of them. So as part of the rotation, you would have an opportunity to participate in their care.
Right, in our main OR, right?
In the main OR, that's
Yes.
right. Mm-hmm.
And what do you think are some unique aspects of the PD cardiac rotation?
Well, in addition to the ones that we just mentioned, it is that it's a very small fellowship program with, on the other hand, a very big Peds cardiac program, however. So that means we have only 3 Gen Peds fellows and 1 advanced pediatric cardiac fellow. And we will schedule them in a way that, while the advanced Peds cardiac fellow is doing his or her out of OR rotations, meaning like ICU, for example, that the Gen Peds fellow then will be in the OR, meaning that he or she can have the total pick of what he or she wants to do or what we deem as most educational for him or her. And then the other thing is that we also have an extremely good working relationship collaboration with our cardiac thoracic surgeons, the ICU attendings, and the cath lab attendings.
How busy is the cardiac service, and what types of cases do the fellows do? And maybe tell me a little bit about the procedures they do as well.
So on average, over the last years, we had about 600 cases for each in the cath lab and in the OR. So that includes pump cases. And so that's pretty busy, and it doesn't include the non-cardiac cases that Dr. Rouine-Rapp was referring to. We basically let the fellow do all types of cases, including in neonates and infants. This also applies to placing any lines like arterial lines or central venous lines, which is also a highlight compared to other programs where we know that the surgeon actually will place those lines very, very frequently. And because of our high volume, particularly in the infant neonatal population, we recently had a neonatal center of excellence established that is a multidisciplinary center, which one of our colleagues, Dr. Nguyen, is representing anesthesia for. And the idea is to particularly provide specific care, special care for preemies.
Great. Tell me a little bit more about the surgical team.
So the surgeons, we have a total of 5 surgeons at this point, and they're covering all aspects, whether it's neonates, infants, transplants, also adult congenital procedures are being done here. And as I had said, we are lucky that we have, a really, really good working relationship with them. They are part of the Pediatric Heart Center, which includes the surgeons, the ICU, cardiology, as well as us. And it's overall also a growing program in various aspects. And we are basically encouraged and invited to, collaborate with them on various aspects too.
Great. Now you mentioned that there's an advanced PD cardiac fellow. Tell me a little bit about how the general fellows interface with this advanced fellow and how that all works.
Yeah, so we have 1 Peds advanced fellow, and however, he or she will spend quite some time during the year also in non-OR rotations. That is primarily the ICU, then for echo rotations, as well as like for research rotations. And for that reason, we will schedule the Gen Peds Fellow in those months for sure in the room when there is no advanced Peds Cardiac Fellow. So I think it's very important to emphasize that there is in no way any competition between two different, trainees about the same patient or anything like that, or that there is like a premier, second tier, differentiation. It really is about the teaching and the experience for the Gen Peds Fellow, and to give him or her the max output and exposure as possible.
Great. Tell me about the didactics or teaching structure for the rotation.
So apart from the general teaching in the OR, there are two main venues. One of them is the fellow conference once a week, and the other one is our multidisciplinary cardiac thoracic conference that takes place in the morning, where cases are being discussed.
Perfect. And how about research projects that are going on within your division?
So that's a broad opportunity as well. So we have several people being involved either in basic science, translational projects, clinical studies or outcomes research, QI improvement projects, and they, for example, include handoffs in the ICU, fast tracking various cases, things like that. And it's highly encouraged that anyone who is applying and has some certain interest in that to get on board with that as early on. And we definitely foster that and provide mentorship for that.
Great. And I guess finally, just tell me or tell our applicants a little bit about the culture in your division. How can you describe your division to the applicants?
Yeah, I think, it's if I were to describe it, I had to describe it with one word, I would probably say it really is, almost like a family. It's extremely cohesive, very, very supportive. There's no question that, that one helps each other. And one of those reasons is also that we do not have any CRNAs in the cardiac OS. And we, as I said, we don't really rely on any trainees. So we otherwise work very, very closely together anyway. And that's basically only possible if you otherwise also have a good relationship with each other. So, having been at other institutions, I really can say that, and everyone is agreeing to that we are grateful to have such a really, really unique and cohesive team.
Well, thank you both for your time today talking with me about the rotation for our applicants. I will send applicants your way if they have questions about the PD cardiac experience. I appreciate it.
Please do. I just wanted to add a couple of things just to let the applicants know. Some applicants have come and asked about adult congenital patients and how much they would have to take care of an adult. It's about 15% of the patients who are in the OR and about 15% of the patients who are in the cath lab. And anybody over the age of 18 is considered an adult. So those numbers need to be considered when one is discussing that. So that's been a question people have asked in the past. And the other question about the Pediatric Heart Center, it's a very cohesive group and we do a lot of things together. And really by the end of the month, each fellow is functioning as part of the team, which is a very unique experience in the years that I have done this. One of the observations that I have made is that by the end of the month, the fellows oftentimes on first name basis with everyone in the room, just like the rest of us. And that's something I think that we can be proud of.
For sure. It's great that they're that well incorporated into your group.
Well, we try.
Yes, absolutely.
Very good. Well, thank you again for your time. Really appreciate it.
Thank you.
Thanks, Mala. Thank you.